We're going to not give you the pharmaceutical thought process. We're going to give you the functional medicine thought process. What would a functional medicine approach look like?
Pharmaceutical-wise is putting people on antidepressants and anti-anxiety medications because we do know that there's this gut-brain axis that is at play with irritable bowel syndrome.
7 to 8 of the top 10 killing diseases in America are inflammatory based. So if you want to reduce your diseases, reduce your inflammation.
Neck pain, backaches, headaches, fatigue, the list goes on, and you're likely on it. Tired of the broken system and big pharma? We offer logical solutions, teach you to think critically, and empower you to reclaim your health. Welcome to the Unplugged Healthcast with Dr. Kevin Wall.
Hey, welcome back to the Unplugged Healthcast. Hey, this is Dr. Wall, your host. Today I'm excited to have a conversation about something I think about way too much. Have you ever heard someone say, name it, claim it? Like, if you say it out loud, it becomes yours. Or if you ever heard someone say, speak life over you. Or if you go back to the Bible, God spoke the world into existence. The reality is there's a lot of power in our words. And I don't think we realize that. We do when it comes to business. I see a lot of great business people, a lot of entrepreneurs, a lot of motivational speakers talk about this, but I don't see a lot of doctors talk about this. In fact, I see the opposite. I see doctors naming people's disease and claiming that over their life, the rest of their life. And it drives me crazy. I see so many patients. I talk to so many people that are wearing their diagnosis like it's a label. They almost even speak sometimes pridefully, like, I have this, look at me. And that becomes who they are. It isn't really a disease, it's a label, it's an identity. It almost at times looks to be like a religious profession of faith that you are stuck this way the rest of your life. And this podcast today is about the power of diagnosis in good and in bad, because often we get a label, we get a diagnosis, and that's who we become. I'm not saying you shouldn't search to find causes of why you feel bad, and maybe there's even a time for a real diagnosis out there, but I really want to encourage you with this podcast that you would stop labeling and ending your disease at that point. The name is the beginning of your journey, not the end. In fact, I want you to start asking not what do I have and what do you call it, and start saying why do I have it and why is my body not functioning? There's a big kick out there today for functional medicine. If you haven't heard it, look it up. There's somebody around you that's named or labeled their practice as a functional medicine practice. They may be a functional medicine doctor. Often they're medical doctors, PAs, nurse practitioners that have went beyond the typical pharmaceutical scope of practice, and they saw what I see every day, that the king's not wearing any clothes, that big pharma's not really getting you healthy, and they want to find better answers for their patients. So they start researching and taking additional classes for functional medicine. And basically all that is they're looking to find the cause, the why. I need you to get past these names. In fact, the name in itself drives me bonkers. These names are not some like discovery that they just found a virus. No, they actually came in with patients who had symptoms. They didn't know what the cause was, and so they came up with a name. Like, let me give you a couple examples. Irritable bowel syndrome. You know what that means? That means your bowels are irritable. Huh? Okay, duh. Like, that is not a diagnosis. That's a name for your symptoms. Headaches, that's not a diagnosis. Migraine headaches, those are bad headaches that have a vascular nature, but they're just headaches. Head is aching. See, there's so many. Fibromyalgia, that's a big one. It's what was originally called the garbage can of diagnosis. Anybody that didn't know what to deal with, they put them in that can. And basically, fibro means fibrous tissue, and myo means muscle tissue. Your fibrous and muscle tissue are algia, aching. Fibromyalgia, that's not a disease. That's a name for your symptoms. I can go on as I like to rant, and I'm not saying the doctors are out there, and they're idiots. I'm just saying you got to stop buying the name as it's the end of your condition and the end of your journey. At the beginning of your name is the beginning of your journey. If your fibrous muscles are aching, you should ask why. If your bowels are irritable, you should ask why. If your head is aching, you should ask why. Not what drug do I take, because there is very little answer, very little long-term solution to just a pill. You may need to get relief. I totally get that. In our offices, we have phenomenal medical providers who at times write prescriptions to get people out of the emergency, to get them out of the crisis. Totally get it. And that's where I believe Big Pharma has made a difference. They get people out of crisis, but they don't really fix a lot of problems. We need people that think functionally. We need you to think functionally. We need you to seek and sought after people who think functionally. So today I've invited into our podcast one of my favorite teammates on our AFC Physical Medicine, somebody who's been working with us for, I think, 5 or 10 years. I know she's been working in functional areas of health for 10 years, and she's been working with us close to 5. Would you welcome in to us Emelia Kay? Emelia, so great to have you. And first, I got to start off with congratulations. You just had a baby.
Thank you. Yes, 4 weeks old as of Friday. So
Well,
she's
it's
growing.
such a pleasure to have you on the show, because I know you probably are up to your ears in baby situations. But why don't you give us a little bit of your background that I left out, and tell us maybe why you kind of sought maybe working in our scenarios, or why you sought out more functional-based medicine.
So a bit about me. So I have been practicing as a PA since 2018. I've been at AFC for the past 5 years, but prior to that, I was working in primary care in New York City, treating a variety of conditions, everything from abnormal pap smears to annual physicals, chronic anxiety. I then relocated to Arizona, and I started working in gastroenterology for a clinic called Arizona Digestive Health. But to be honest, I was getting a bit fatigued of the allopathic, so to speak, Band-Aid approach, where we were just pushing medications to relieve a symptom. So I ended up in the chiropractic physical medicine space about 6 years ago, and I haven't really looked back since. And what really inspired me to pursue medicine in the first place is my parents. I grew up exposed to the medical field at a very young age because both my parents work in the medical field. My dad is an internist. He still practices in Phoenix now. My mom's the PA, and she's a functional PA. I got to see kind of both sides of the coin, someone who was very allopathic in their treatment and someone who was more functionally minded. And I, kind of followed along with my mom under her scope. I started shadowing her at a very young age, and it just felt like such a rewarding career path, and it really has lived up to that.
Well, that's awesome. And I do remember that when we first talked 6 years ago. But I talk about functional medicine like I know what I'm talking about, but I'm just about enough to be dangerous. Why don't you take a moment, maybe explain how you think, how your mom thinks, what is a functional medicine doctor? Let's just go there.
Yeah, so let me kind of, actually even revert back a little bit and kind of explain the difference between what conventional medicine looks like versus what functional medicine looks like. So when we say allopathic, or what we call Western medicine, versus functional medicine, the approach is really treatment and diagnosis is vastly different. So with allopathic or conventional medicine, we're really focusing on diagnosing and treating specific diseases and managing those correlating symptoms via these standardized protocols, and usually they're evidence-based. But there's a really heavy reliance on prescription medications, on surgical intervention, on procedures to address symptom control. So it's more so addressing the what and not so much the why. Whereas with functional medicine, we're taking more of a comprehensive approach to treatment. We're dissecting people's gut health. We're looking at possible impacts of stress, maybe environmental factors that are at play, so on and so forth, to really understand the root cause of the issue. So treatment is going to vary significantly. So now, instead of focusing on pharmaceuticals or surgeries to cure a disease state, we're looking at a patient's nutrition, maybe utilizing supplements. We're encouraging lifestyle changes to make more of a long-standing impact and leading to prevention later on.
I love it. And thank you for bringing that and being a part of AFC, because that's just why we want to combine medical with chiropractic, because there is the best of both worlds. There's a place for all of it, but this is a unique place that's growing rapidly. And the last 10, 15 years, I've seen this expand, and honestly, it makes my heart warm to see really awesome medical people who went in practice to help people, and they understand the pharmaceutical, but they at times know when to use the functional, and that's great. And that's what we want to see more of in the next 10, 20 years. So here's what our plan is today for our listeners, people out there, and for future podcast listeners. We know that you are stuck on, you get the diagnosis, you get the prescription, and you maybe want to do more, but you don't know what more looks like. So we're going to try to give it to you today. We're going to talk about individual diagnoses, and then we're going to not give you the pharmaceutical thought process. We're going to give you the functional medicine thought process. What would she say? What would they do? What would a functional medicine approach look like? So that's the plan. We're going to make it happen. Let's get to it. We're going to start right in your wheelhouse. I know that you were published at one point in a magazine. I think it was Journal of American Physician Assistants, and you were published in an article about non-pharmaceutical options to treating irritable bowel syndrome. I led the show off with irritable bowel. It drives me nuts. It doesn't tell us anything. Maybe you can tell us, what is irritable bowel and how do people get out of it without drugs?
Yeah, so irritable bowel syndrome, it's complex, right? There are various forms of IBS. There's IBS-C, which is irritable bowel syndrome correlated to constipation. Some people will be IBS-D, which is irritable bowel syndrome correlating to diarrhea. And you can also have what's called IBS mixed, which is both a combination of constipation and diarrhea, where a lot of the times, believe it or not, it actually has to do with our stress levels. And people who tend to be more anxious, because we have more serotonin receptors in our gut than we do our brain, will manifest GI symptoms as either constipation or diarrhea, or maybe a mixture of both. And the normal treatment, so to speak, from a conventional standpoint, is actually pharmaceutical-wise, is putting people on antidepressants and anti-anxiety medications, because we do know that there's this gut-brain axis that is at play with irritable bowel syndrome. But from a functional standpoint, to put someone on a antidepressant or a tricyclic antidepressant, for example, like nortriptyline, which has crazy side effects, you're treating one thing, and then you're ending up with, a plethora of side effects that you're having to address as well. So it's not really a cure, right?
Yeah.
So what really I recommend is looking more at, from a functional standpoint, is there some imbalance in maybe the bacteria at play that's causing this? So is there a dysbiosis, meaning there's not enough proliferation of good bacteria? We're having too much bad bacteria. That's causing the lining of the colon to be affected. So maybe we need to reintroduce healthy gut bacteria via whether it's diet or a supplement. Maybe it's digestive enzymes that they're lacking. Maybe it's a food sensitivity issue that's causing leaky gut that's quote unquote IBS-like symptoms.
It starts, it seems like, with the thought process of stress.
Right.
And should people then try to reduce their stress as their first line of defense?
Absolutely. But do I think jumping to a prescription medication is the way to go about it? Absolutely not. There's acupuncture, there's meditation, cognitive behavioral therapy, studies have shown has worked wonders for patients. So there are ways to curtail this without starting a pharmaceutical that patients may end up getting tons of side effects from.
When you're in pain, it's the little things that make a big difference. A friendly face, a warm welcome, and a plan that finally works. At AFC Physical Medicine and Chiropractic Centers, we take the time to understand what your body really needs, providing personalized care that gives you real relief. Because feeling better isn't just about treatment, it's about feeling like you again. Give us a call or visit our website to start your journey to a pain-free life.
It's such a cycle you'll never get out of once you go down that road, it seems like. Now, I've also heard that statement, your gut is your second brain, or the second brain is your gut. And so that goes to that serotonin receptor. I think that was just a brilliant statement you made there that people probably don't know what people mean when they say that. There are more serotonin receptors in your gut than there are in the brain. Why don't you talk about that?
Yeah, I think cortisol plays a really big role here because cortisol is our stress hormone. So I think getting blood work first and foremost, and maybe checking a morning cortisol level could be really great, because if that cortisol level is above 20 is usually the threshold that we're looking at, we know that we're in this fight or flight state at all points. So there are natural ways, even with supplements, to help reduce that cortisol level, improve that serotonin and dopamine back into the system. But we need a baseline. And I think getting blood work and seeing where we're at with that can make a significant difference for sure. And there's something called magnolia bark that I really like that works great for lowering cortisol levels naturally. But again, without knowing what that level looks like, it's kind of shooting in the dark.
And that's where most people do. They just start buying stuff, taking stuff, doing stuff, but they don't really have a baseline to know if it's actually helping. And often they probably quit before they get the benefit, because the benefit would probably take a while versus they go to the quick fix, right?
Yeah.
What are your thoughts? Because I'm now a big fan of cold plunging, because I know what it does, and it gives me that serotonin uptake. Do you think things like that, natural cures like that, are good for irritable bowel patients?
Yes, I think it depends. I think for some people, the act of being in a cold environment is actually quite stressful and anxiety producing. So I think it really depends on the patient. For other people, it works magic. I personally love it. I'm a big advocate myself. I go to Live Colder Cryo. But again, not for everyone. But for people that can tolerate it, I think it's wonderful.
Now, I see the sauna behind you. Is that an infrared sauna? And is that a way to help? Because I know that can also do the same thing.
Absolutely, yes. We know that infrared light decreases inflammation, it decreases our stress level, and it increases that serotonin. So absolutely, highly recommend.
Okay, I'm going to call out what people call out on me. You seem to be very casual that it's so simple to fix my irritable bowel syndrome. Avoid the drugs, to start taking some probiotics, get some digestive enzymes, figure out how to manage your stress in a non-pharmaceutical way. Is that enough?
No.
Can people really get this thing under control? Because I think they think it's more than that. Is it more?
It is more than that. So I think that this is why functional medicine or going to see a functional provider is really, can be extremely advantageous, because they can do things like stool study testing, where they're actually physically looking at the microbiome via the stool and seeing what bacteria maybe the patient is lacking that's also contributing to their IBS symptoms. Once we address those things, or it could be heavy metal exposure. It could be a neurotransmitter issue. It could be, what else? Again, back to the gut dysbiosis. These things can be addressed, but you have to do the work in terms of getting the stool studies, blood work to look for these things. Yeah, you don't want to just shoot in the dark. You really should get a comprehensive workup.
I want to wrap this one up by statement to encourage everyone listening. They say, and you have heard, death begins in the gut. And often the initial signs of you going the wrong direction are your stomach. Acid reflux, just an upset stomach, food inability to digest certain foods, bloating, constipation, and now you continue to just treat the meds. Now you have IBS, and then you treat it with more meds, and all you're doing is slowly dying. That's just a fact. And so you've got to consider more simple, logical, functional solutions. This is the reason that this podcast exists. This is the reason I'm still practicing and helping clinics think this way, is because it's life. Life begins in the colon. If death begins in the colon, then life also begins in the colon. So fix your colon, fix your gut, and don't just mask your IBS. All right, let's move on. We got a patient. You and I see this all the time, headaches. I did a podcast on headaches. I'd like to talk again about it, but let's you talk about headaches. There's lots of different types of headaches. In my opinion, I think they're all similar. It's your head is aching, something's missing. What would you tell a patient from a functional medicine standpoint to treat their headaches?
Yeah. So headaches are extremely interesting because there are so many causes of headaches, right? It could be dehydration. It could be a hormonal imbalance. Maybe it's a sinus or TMJ issue. Maybe it's related to high blood pressure. But they can also be related to certain vitamin deficiencies that maybe people aren't really aware of. So, for example, studies show that people who are deficient in magnesium and riboflavin, which is vitamin B2, have a very strong correlation with headache onset if they don't treat those deficiencies. So I actually recommend that instead of someone like reaching for that bottle of Excedrin, try taking both vitamin B2, like I said, riboflavin, 400 milligrams is usually what I aim for, in conjunction with magnesium, also 400 milligrams, so that's pretty easy, and see if that can help abate the headache. And sometimes when people are in a flare-up state, I even tell patients, maybe you can up that magnesium to 800 milligrams as long as your bowel movements you're not on the looser end of things, because magnesium helps treat constipation, so it can cause some looser stools. But if you don't have that issue, up it to 800. There's another supplement called CoQ10. It's a coenzyme, and it helps to reduce oxidative stress on a cellular level, which can also have massive impacts on headache reduction. So my typical trifecta is doing that magnesium, the vitamin B2, and the CoQ10. And actually, even neurologists are recommending this now.
Yeah.
But we want to also make sure that we're supporting the nervous system and patients' stress levels. So again, this is where acupuncture can come into play big time. Chiropractic care, deep breathing can be quite helpful. And also, other things like proper sleep hygiene, make sure we're well hydrated, those types of things. So there's a multitude of factors.
I love it. A great job on that one. That's just a simple takeaway for everybody. But I get a little you've been around me for 5 years. I get a little bit high on my horse thinking that I can fix everything. I've had, in the years that I was in hard practice, a 90% success ratio on treating people's headaches. I just didn't think it was that hard. I think today's patients different than when I was in full-blown practice. But I'm just curious, if someone comes up to AFC Physical Medicine at Desert Ridge, this is where you're at, they often get to see you. What's your success ratio on people with headaches?
I mean, I think that it's pretty high. And again, it's not that we're just recommending supplements. We're doing the chiropractic, we're doing the PT, we're doing the trigger point injections from a structural correction or standpoint. If we're correcting those areas, we're seeing great success.
And then you're adding in your functional medicine perspective for that outlier that doesn't maybe just get better from the stability, structural stuff. So
Yeah.
I just want to toot your horn because I know how good you guys are up there, the results you get. And if you got headaches and you're looking for an answer, AFC Physical Medicine, I'm tooting here. And if you really want to if you're not getting fixed at one of our clinics, go to Desert Ridge because I know Emelia will be there along with Dr. Jenny, and they will take care of it.
Yes.
All right, well, let's move on here. Let's go to one of the biggest epidemics in today's society. It's metabolic disorder. It's insulin resistance. It's type 2 diabetes. What do you do from a functional medicine standpoint? I've talked about this too much. Tell me what you're going to do.
Okay, I love this question. So insulin resistance is incredibly important because it can lead to a lot of downstream complications if we're leaving it untreated, right? It's causing diabetes, it's causing heart disease, it can cause stroke, that metabolic syndrome that we talked about where you're having that trifecta of high blood pressure, high cholesterol, and diabetes. When our body stops responding to insulin, our glucose is staying in the bloodstream as opposed to going into the cells for proper energy and storage. So there are several supplements that can really help to curtail this. My favorite one is called chromium. So chromium, it's a vitamin that really mimics insulin. It pushes that glucose from the bloodstream back into the cell so that it can be used appropriately.
Are you struggling losing weight? Do you need a metabolic reset? Are you concerned about diabetes? Hey, it's Dr. Wall here, and it's time to take action. It's time to get unplugged. Here's the simplest solution I've ever seen for losing weight. Reset your metabolism, reduce your A1C levels, and reverse your type 2 diabetes. It's time to feel great again. Hit the link in our show notes or go to drkevinwall.com and learn more about our Feel Great system. This product curbs appetite, reduces your cholesterol levels, increases your HDL levels, and supports normal blood glucose levels. It can increase your GLP levels by 70% when fasting. You don't need Ozempic. It's time to take control of your health again. Hit the link in our show notes and watch the belly fat melt off.
Another supplement that I really like is something called berberine. It's a plant-based compound, which I recommend because it helps to reduce A1C levels, which is a snapshot of what your sugar is over a 3 months time frame, and it improves insulin sensitivity. Something that I think is really interesting that people may not think about too is cinnamon. Cinnamon is capsulated. It's available in capsulated form. So you can ingest cinnamon capsules, or you can utilize cinnamon naturally and throw it, on your overnight oats or in your coffee, in a smoothie, but that can help to support healthy glucose levels as well. Diet is obviously going to play the biggest role here. We want to avoid carbohydrates, processed food, artificial sweeteners. That high fructose corn syrup we know is a big troublemaker. Horrible. And it's even in the ketchup that we eat.
Everywhere.
It's in everything. So looking at labels is extremely important. And then another thing that people don't think about, but again is so vital, is this cortisol level. Because our cortisol, if it stays consistently high, it's gonna make your body less responsive to that insulin. So again, checking that AM cortisol level via blood work can be really advantageous here.
A lot of people think they get blood work, but most typical blood work from a primary care, in my opinion, is not looking at that morning cortisol level. Is that true?
Yep, it's very true. It's so funny when patients come to me and I order labs on them, or they'll bring in labs from their, primary care doctor, and it'll have a CBC, a CMP. You're lucky if you get a vitamin D level in there, and a sugar, and maybe a cholesterol panel. And then I order, 7 vials worth of labs, and they're like, no one's ever checked these things on me. And I'm like, yeah, because it's not conventional. So it's really nice that they get to see that difference in care.
Now, as much as I love to throw rocks, they already know that. I got to step back. I love primary care doctors. What a blessing they are to our world. But the reality is if you would tell me if I'm wrong, there isn't a lot of time in school that they ever get educated on what to do if they found a cortisol level issue, right? So they don't look for it because honestly, if they find it and they don't do something about it, there's a liability problem. So where is the point is they're not looking for it because they don't know what to do with it. Is that true? Is there just a lack of real medical school education on these nutritional components?
Yeah, I can speak from my own personal experience where in PA school, we weren't taught these things. These are things that I've kind of educated myself on via going to, conferences that are more functionally based or following providers who are functionally minded. You really have to do your own research unless, you're an ND. You weren't necessarily taught that there's a correlation between cortisol and insulin resistance. So probably what's happening is they wouldn't know how to treat it or look for it, and so it's not getting addressed.
Yeah. So the doctors have to just go get the education on this stuff, which a lot of them are doing, you being one of them. And I have a lot of great friends as medical doctors who are going past the typical schooling and learning on this because we're asking them to. The patients need to ask the doctors because unfortunately they may not get them to change unless we start pushing them. I think that's just a fact. Okay, well, let's switch gears here. Let's go to something a little outside of the normal but common. Hair loss. Now, we're not talking about me, where my grandpa, his grandpa, my mom, everybody lost their hair. I think we're talking about hair loss more from hormonal imbalances, women, but I know it's something you're passionate about. Talk to us about hair loss and what people could do to either reverse it, stop it, maybe not have it.
Yeah, so hair loss has become a really popular focus right now in the health and wellness space, whether it's related to, postpartum hair loss, if it's hair thinning, so on and so forth. But I think we all know that usually the first and foremost, thing that we look at is thyroid function, because we know that an overactive thyroid can cause hair thinning because our thyroid gland affects hair growth cycle directly. That's an obvious one. That's something that, conventional medicine always looks at. But what about maybe some other deficiencies that can be correlated with hair loss that people aren't thinking about as much? There are several. So believe it or not, vitamin D actually moves the hair cycle from a resting phase to the growing phase, and it works as a very important anti-inflammatory. So having vitamin D levels of sus can checked via blood work can really affect our hair growth. So if you're under 30, I definitely recommend supplementation. Another vitamin is to consider is B12. People always think about biotin, which is vitamin B7, but I'm going to debunk that in just a second here, but it's really more so B12. So B12 is extremely important for DNA synthesis, aka the formation of the hair follicle itself. It also is really important in terms of transporting red blood cells and oxygen to the hair follicle. So people think that it's B7 because vitamin B7 or that biotin is directly correlated with hair loss because it's involved in keratin production. But quite frankly, to have a true biotin deficiency is actually really rare. What's more common is the B12 deficiency. We see this with vegans. We see B12 deficiencies in people who are on anti-acid medications, proton pump inhibitors like omeprazole, Prilosec. People who are taking metformin are also having low B12 absorption. So this is something that we always have to check. You're lower than 300 for B12, and you're taking, the metformin or the proton pump inhibitor, or you're vegan and you're experiencing hair loss. I think that there's a definite correlation there. Another important marker that I really like is looking at iron. Iron also helps to deliver oxygen to the hair follicles. So if someone has iron deficiency anemia, maybe they have really heavy menstrual cycles, it's not uncommon to have some hair loss associated with that as well. If you have a high clinical suspicion for someone with like polycystic ovarian syndrome, some sort of autoimmune issue, then it's really important to also check things like testosterone levels, maybe adrenal function, inflammation markers can be really useful here, but it really is patient dependent.
With a high level of insulin resistance, the issues that people are just having metabolic disorders, don't you see PCOS and hair loss also following that metabolic issue? And
Absolutely.
So when you are dealing with weight, when you're dealing with diabetes, when you're dealing with A1C issues, you can almost bet you're headed for PCOS and probably losing some hair. Is that true? Have you seen this tendency? I've seen this drastically increase over the last 20 years.
Yeah, absolutely, because PCOS and insulin resistance go hand in hand. So yes,
Hand
there
in
is a
hand.
direct correlation there. And once you get that metabolic syndrome on board, it's just this vicious cycle, and you really have to
It
address
is.
these things.
You got to go to that one almost first.
Yep.
But okay. You said something about vitamin D. I want to go back to for a second because in Arizona, which is where we're at, and in a lot of places where sun is shining, people think they don't need vitamin D. We actually have, don't you notice, the biggest vitamin D deficiency in the country in Arizona? Because I think people think they've heard the sun gives it to them, so they don't take it. That's not true. Talk to where they can get it, and they don't just rely on the sun, even if they're in a sunny state.
Yeah. I mean, you can also get it through diet. So dairy, milk, cheese, fish. But quite frankly, none of this, not the sun, not the diet, really can give us the amount of vitamin D that we need. 70% of the US population is going to require a supplement, and that's just what it is. It's unfortunate, it's the case, but you know what? It's a necessary vitamin. It's involved in so many functions. It's anti-cancer, it's an immunobooster. So get the vitamin D on board.
Great job. We got time for maybe one more. Let's see. Let's hit allergies.
Okay.
Autoimmune disorders, allergies, you pick. You want to talk about one or both? Because I think they're probably similar or the same. But
Yeah.
which one do you want to hit?
Let's talk about allergies. Let's talk about environmental allergies. Environmental allergies, this is something that I'm extremely passionate about and treat almost daily at the clinic I work for. I think it's so important to simply just get allergy testing, whether it's skin, whether it's blood, because it gives patients so many answers to chronic symptoms that people are experiencing, but they're not necessarily correlating them to environmental triggers. If someone's having chronic headaches, if they're experiencing fatigue, if they're having brain fog, if they're having joint stiffness or pain, and it can be, worse during high pollen count, usually that's related to the allergens, the environment, but people just aren't aware of it. Allergies cause internal inflammation. And what I think people don't realize is that symptoms don't necessarily have to be localized to the nasal cavity. I mean, they're generalized symptoms, right? They can manifest as anything under the sun. So allergy testing and subsequent allergy shots or immunotherapy treatment should, in my opinion, be at the forefront. But now if you're looking for some quick fixes that are natural from a supplement standpoint, there are a few that I really advocate for. One of them is called quercetin. So quercetin is a plant flavonoid. So you can see this in onions, like red and white onions. We see this in apples, berries, but it's a natural mast cell stabilizer, which means it works like an antihistamine would, but it's not giving you those harsh side effects that like the Claritin or the Zyrtec or Allegra can elicit. Bromelain is another one that I really like. This is one that is extracted from the stem of a pineapple. It also has really great antihistamine properties. It reduces swelling and inflammation in the sinuses. It can thin out the mucus. It's great for sinus headaches. And then we also know, obviously, that vitamin C is a natural antihistamine and a powerful antioxidant, and it can really help to support immune function. I really like a supplement called D-Hist. It's by Orthomolecular, and it has a combination of all three of those things, which is definitely worth a try.
I just want to put a prop in because a lot of people hear our commercials, maybe if you listen to the podcast for AFC Physical Medicine, and then the word physical medicine kind of overrides their thought. And in our clinics for the last 10 plus years, we have become very effective at allergy care. And it's part of physical medicine because of what Emelia just said, is that we all think allergies are sneezing, rubbing your eyes, itchy eyes, coughing. And I'm telling you, what you see on the outside is a small percent of what's happening on the inside. And on the inside means your gut, your bones, your joints, your muscles. Allergies do proliferate in symptoms that you don't think about. And she just hit it. Joint pain, back pain, muscle pain, gut issues. That can be as simple as an allergy to your environment. We do testing at our clinics for environmental and food allergies. It's a great way for us to identify inflammatory reactors, things that are causing your body to be systemically reacting, systemically inflamed. When you notice that you have multiple joint problems, multiple conditions, multiple symptoms, and now you get this multiple diagnosis that we started this show off with, all these names, I guarantee you don't have 6 diagnoses. There's no way someone's got 6 diseases. You probably have one systemic, chronic, underlying inflammatory issue going on, and it's affecting you from the cellular level, causing multiple symptoms and then, i.e., multiple diagnoses. Some of the simplest things you could do is go to a functional medicine doctor, come to one of our clinics, AFC Physical Medicine, get tested for allergies, and get on immunotherapy. I used to be against it because I didn't understand it. Ignorance was bliss for me. I thought you were injecting these things into your body that were bad. But if you understand immunotherapy, all they're doing is taking what you're allergic to in a tiny fraction, putting it in saline, which your body's full of salt water, and injecting it slowly, building up your tolerance. It's a great way for you to calm your immune system down, reduce autoimmune disorders, increase your immune system tolerance, and reduce your inflammation. As I say, 7 to 8 of the top 10 killing diseases in America are inflammatory based. So if you want to reduce your diseases, reduce your inflammation, come into our clinics, go to an allergy clinic, go to a functional medicine doctor, and find out why you are sick. Stop believing the label and start asking why. Ask your doctor, ask yourself. Go Google it right now. ChatGPT, I think, knows more about things than most doctors do when it comes to why you're sick. But you need to team up with a professional like Emelia, like her mom. So Emelia, why don't you wrap us up? Let's promote. Is your mom still in practice?
She is, yeah. She works at Essential Family Health and Wellness with Dr. Susan Del Sordi, who's a naturopathic doctor. And it's kind of a one-stop shop clinic where they have an acupuncturist on site, they have a nutritionist, they do cooking classes, vitamin IV therapy. It's amazing. And the best part is they take insurance. So to have a functional medicine clinic that takes insurance is a dime a dozen. She loves this space. She herself dealt with mold overgrowth in her body internally, and she utilizes the things that she recommends patients on herself all the time, and it's a great resource.
And if they want to find you at Desert Ridge, can they come up and see you?
Yeah, absolutely. I would love it.
AFC Physical Medicine of Desert Ridge, which is one of our Phoenix locations up in the Desert Ridge area. That's where Emelia's practicing, and you can find her there. And we have other great PAs just like her in every clinic that think like her, that do allergy testing like her. So come check us out. Go check somebody out. But this is Dr. Wall and Emelia. We're going to sign off today on the Unplugged Healthcast. Always remember, be blessed, be healthy, never give up, never give in, and go find out why you're sick, because there's a reason. You can get answers. We'll see you again on the next episode of the Unplugged Healthcast.
The information provided in this podcast is for general knowledge and informational purposes only. It does not constitute medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment of any medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the Unplugged Healthcast or Dr. Wall.